Hello, everybody. Welcome to this podcast around Pharmacists Career Pathways. My name is Preeti Minhas, and I'm the Assistant Director of Clinical Education at Education for Health. And I'm delighted to be joined by a number of pharmacists from all different sectors, including the devolved nations as well, who are going to talk a little bit about their role, a little bit about their development, and what advice they can give to pharmacists who are currently moving sectors or moving roles, and in terms of what development that they may want to press ahead with. So I'll go around the room and just get you to all introduce yourself. So if I start with Shilpa.
Hi there. Hi, Preeti. Nice to be here today. So my name's Shilpa Patel, and I work in Brighton. And I work for a GP practice. I was in community pharmacy for about 15 years before this, and I've been in GP practice as a prescribing pharmacist for about 9 years now. And I became a partner at the surgery 5 years ago, and that's kind of opened lots of doors to me, and it's taken me on bit of a roller coaster journey, which I've kind of been talking about a lot on the social media and kind of sharing with people, just to be able to inspire people. And I do a lot of work on helping people become prescribers, helping people get into general practice, and also showing them the way to become a GP partner.
Great. Thank you so much, Shilpa. And it's great to see you again, because you recently recorded our Leading in Women podcast as well. So thank you for joining us today. Charles, if I could get you to introduce yourself.
Thank you, Preeti, for inviting me today. So my name is Charles Adiase. My role at present, I'm a consultant pharmacist in primary care and diabetes. I've worked across multiple sectors. So I started off in community pharmacy as a relief pharmacist for one of the high street shops at the time, Cohen's Pharmacy. And then I worked into hospital. So I've been in hospital for a while. So different hospitals across the country, Sheffield, Winchester, Basingstoke. And then I did some training over that period of time to develop my specialist skills. And then I came into general practice. So I was a diabetes lead and prescribing lead for a GP practice in Reading. And then I moved into a GP federation in Hertfordshire, where I was the consultant pharmacist for the federation. And since then it's just been history, getting involved in different things with GPSC, with Diabetes UK, which is one thing I'm passionate about, and just running clinics and doing a lot of stuff around pharmacy. And I think my main goal in life is to try and inspire pharmacists to, try new things and to develop themselves, to have their independence in their career path.
That's great. Thank you so much. And we did a couple of weeks ago, didn't we, for Diabetes Day? We did a little podcast, didn't we, around how can we support quality outcomes for patients with diabetes. So no, thank you for coming on board. And Samantha, if you could introduce yourself.
Hi, Preeti. Thanks for inviting me along today. It's great to have some input, as you say, from the devolved countries. So I'm currently a chief pharmacist in primary care and meds optimisation for Cwm Taf Morgannwg Health Board. Only a month into the role, working for the NHS after a 28-year career in community pharmacy, working for Lloyd's Pharmacy and then latterly McKesson. So started my career with Lloyd's Pharmacy, undertaking my pre-reg. Spent about 15 or 16 years in various field manager roles, managing the community pharmacy estate across all devolved countries, so Scotland, Wales, Ireland, Channel Islands. So lots of experience of different countries' contractual frameworks. And then for the last 10 years of my career, I worked as head of pharmacy affairs for McKesson. So I worked in the external space, worked negotiating the community pharmacy contractual frameworks, sat on the board of Community Pharmacy Wales and PSNC. So I chaired contractor support and LPC subcommittee at PSNC. So making the move to work for the NHS is a big change after such a long career working corporately. I was a board director at Company Chemists Association for 10 years. But yeah, really enjoying it, and fantastic to see the other side of the coin.
That's great, and I think that's where our paths crossed, didn't they, Sam, in terms of when you did that role for the head of external affairs as well. So we did a lot of work around workforce development, didn't we, at that time? So it's great to see you, and you've all had so varied careers as well. So Shilpa to Charles to yourself, Sam, it's also varied in terms of what you've all done, which I think really demonstrates the opportunities that are within pharmacy as a profession. So I guess, and we can open it up in terms of, obviously there are many people that have either just started their careers who are listening to this, or actually maybe in that space where they're just not sure what to do in terms of moving on to another role, or even deciding what turn their career needs to take. So from all of your different diverse careers, I should say, what's the kind of best pieces of advice you would give our pharmacists who are progressing through their career pathway at the moment?
So maybe I'll go first then. It seems like appropriate for it to be my turn. I think when I first qualified, I didn't realize that there were so many different options, and there probably weren't as many going back 23 years ago. But right now there's so many different options, so many different choices. And I speak to a lot of pharmacists who are kind of stuck in a role where they're either not happy or they're not feeling fulfilled. And I'm just like, well, make that move, because there's so many different options available. And I think it's really scary. And I was really scared when I made the move. And, you know, you think you're not going to be able to do it, or you feel that it's too big a risk, just kind of financially and for your family. And, you know, it's going to have too big of an impact, the big changes on your life. But I think if you end up doing something you're really passionate about, you end up doing well, you know. So, you know, whenever people come to me, whenever pharmacists ask me, I would say, look, just take that leap, just go and try something new, because there are so many roles that you're really going to enjoy now, because there's a role for everyone. It's not kind of like you're stuck just doing that one thing.
And it is that of maximizing almost the opportunities that you get in front of you, isn't it?
Yeah, and the fact that we have got all those opportunities now, yeah, absolutely maximizing it.
Perfect. So just going on to Charles then. Charles, what would you say? Because we've had a lot of conversations, haven't we, about development and career pathways?
Yeah, no, I think for me, when it comes to this topic is one very dear to my heart. And I think one of the reasons why it's dear to my heart is that one of the things pharmacy often lack is mentorship and support. When I started my career, I didn't really have any blueprint per se to follow. Everybody wanted to follow the same blueprint: buy a new car, go into community pharmacy, hostel pharmacists for those that are bored. Everybody just had their own set rules about these different sectors. But fortunately for me, I sort of had a plan in my head, and I think that's the more important thing. You need to have a plan in your head what you want to achieve, where you want to end up. You might not know the way to get there, but you have an idea of what will be a satisfying career for you. Because it's not about just the moment in time, but what you're going to do when you get older. Because as you get older, things change. And, you know, your time changes as well, constraint of your time change, family life changes, you know, what you want to do with your life changes. So having an idea of how you would like to end the race is probably the best way to start that thinking process of your profession. And that's something I was fortunate enough to have. So I always knew I was going to end up in general practice, even though general practice wasn't a thing there. That was always the goal, to end up in general practice. But I felt I needed to go to hospital, build my clinical skills and so on. So at the time, just like how Shilpa said, my colleagues were going to community pharmacy because that's where the salary was. So I took a pay cut to go into hospital to get into training. So it's having that idea of where you want to end, and then think about staying ahead, which I think a lot of people fail to understand. I've always told people that I've mentored, it's all about staying ahead. Don't wait till everybody jump in on the bandwagon before you jump on it. So for example, I'm an advanced clinical practitioner. When I was doing the training, I took a year out to self-fund myself because there wasn't any ACP fund at the time. It didn't exist. But I self-funded because I knew I could see that coming into play and to be useful for general practice. So I took the money out of the bank, took a loan, sent myself to do the course at the time. Nobody knew what that was going to be the outcome of that. But now everybody's jumping on it. And I've always said, if you have the ability to see a bit of where the direction of healthcare is going, which is sometimes very easy to see when you start thinking about workforce problems, you start thinking about, changes in dynamics. We have physician associates, we have advanced nurses. When you start keeping an eye on those things, you can have an idea of where the needs are going to be. Because the needs are where you want to be, because that's where you get the best remuneration for your service, you get better job satisfaction, it's less crowded. Like how we have the community pharmacy now that's overcrowded. At the time, it was the most exciting place to work in, but it's overcrowded. So I think one piece of advice I always tell people is stay ahead. Don't be afraid to be different. Don't be afraid to take the risk and do it early, because the longer you wait, the more pressure you have on yourself, because then it's difficult to take a risk when you have more pressure on you. So staying ahead, don't be afraid to stand out, do it early, and have a clear idea of where you want to end. If you have that in mind, you'll get there at some point, one way or the other, with that flexibility within the plan.
And I think with that, isn't it, with each stage, it's also making sure that you develop yourself. So like you said, you took out a course and you upskilled yourself at a time when actually funding wasn't available, but you did that in order to get to the place you wanted to be. So that's great. And you've taken a lot of external roles as well, haven't you, in terms of obviously supporting other charities, particularly with our charity, but also Diabetes UK. So I guess there's also an element of having that exposure as part of your career pathway.
Most definitely. I think it's about being open to, I think one of the things I've always pushed back when it comes to pharmacy is I personally, as a professional, don't like being in the single standalone pharmacy bubble. I believe in that interconnection with other healthcare professionals. I believe in that interdisciplinary approach to healthcare delivery. So one of the things I used to do, I always tell colleagues, mentors, and I always attended obesity conferences and all these conferences. And usually, you have the medics and everybody in there and they're all bashing pharmacists. And I make it a point of duty to raise my hand up to ask a question, so I could simply introduce myself as a pharmacist, because I always felt there has to be a pharmacist in the room, and I want to be that pharmacist in the room. So you have to have that bit of boldness to be, have that professional pride in yourself, because when you do that, then you can start doing what you've just described, getting involved with Diabetes UK. I'm now the chair of the conference. I'm the first pharmacist to ever be a chair of the Diabetes UK International Conference. So those kind of things are things you want to do to sort of showcase what pharmacy can do. And have a place for ourselves as a profession, so other professions can look up to us, not just within our profession, but outside the profession can look up to us as, as colleagues that can actually hold the fort for them.
Which is great, and congratulations on that. And it's great that those bold moves are now changing the face of the profession as well. So Sam, you've had a lot of diverse roles, haven't you, particularly in terms of leadership and those board directors. So tell us a little bit about some of those pieces of advice you'd be giving people at the moment.
Okay, so I suppose I've got a bit of different advice to Charles. So I'm not sure people always know what the end game is. And my piece of advice would be stick your hand up and volunteer. Get involved in as many different things as you can, because you don't always know what it is that you're gonna love and what it is that's gonna float your boat, I suppose. So from an early age, I was always really keen to get involved in external affairs work. So volunteered to sit on one of my regional Community Pharmacy Wales committees, looking at local service development. Loved that. Throughout my operations career, took lots of different opportunities. I did program management training, and then I ended up heading up one of the PMOs within Lloyd's Pharmacy head office, looking at big infrastructure projects. So I suppose implementing off-site assembly and some of the automation programs, which is just a million miles away from local, negotiation of commissioned services. And then latterly, after I had my little boy, I came back in a full external affairs role, really, and worked as non-exec director on the negotiators, which was a really good mix, I suppose, of the financial side of contractual framework, but the clinical angle around service development as well. So yeah, my career has been really varied, but if you'd asked me 10 years ago, would I see myself working for the NHS in a chief farm role, I would never have said I would have. But I think my background has brought together lots of areas like operations, stakeholder management, and the ability to build networks that have sort of come together in this role, and I'm really enjoying it. So yeah, I'd say you don't always have to have a plan, but you have to be prepared to put your hand up and volunteer for different opportunities. Put yourself out there. And I suppose linked to that, my other bit of advice is build your network. Build your network of people. It will serve you well for the rest of your career. Get out there, meet people outside of your organisation. And I think that bodes equally depending on whatever sector you're in. And I guess in Wales, we are in a fully a full cross-sector pre-reg placement approach. So all our graduates now get to work across all of the sectors. They get to meet lots more people and have an opportunity to experience a whole breadth of activity and start building that network. So yeah, they're my two pieces of advice. Put your hand up, volunteer, and build your networks. And then I think it'll come naturally what you want to do, but you need to create your own opportunities.
And I guess just talking about some of your leadership roles, have you had some leadership development, or what were the key things that enabled you to have that kind of confidence to be able to take that next role?
Yeah, I suppose there's a few things. I've always had absolutely amazing line managers who have promoted people within their teams. So that's always made me want to, you know, pass it on, I suppose. So anybody that's within my team, I would never say, within reason, I'd never say no to them wanting to undertake any sort of development opportunities or get involved in anything, because I've always been afforded that opportunity, and I truly believe that's been the most positive aspect of my career. I suppose working for a large corporate, I've been lucky that over the years there was lots of leadership development opportunities. You know, Stephen Covey, we did 7 Habits, and lots of off-site opportunities for leadership development. And I did also do many moons ago my clinical MSc. So although I kind of quickly moved into field management and didn't really do a lot of clinical work after that. And then I did program management as well. So I've had loads of opportunity for development, as well as things like advanced negotiating skills courses through my role when I was sort of negotiating contractual framework. So development opportunities are usually there for the taking. It's people feeling that they can find the capacity within their working week to fit them in, but you have to prioritize it. You have to give yourself that chance. And yeah, go find a good person to work for that allows you to do all those things, I think is really important, because if you're not working in that environment, it just doesn't allow you to flourish.
Yeah, no, absolutely. And that was actually going to be my next question, which lended itself very nicely to, you know, how we often hear time is I can't do this or I can't do that. How do you through balance your time? Because you've got obviously personal commitments, professional commitments, you know, how do each of you balance your time to be able to make time for those opportunities or time for development?
Well, I'll come in with a quick one then on that, Justina's, and I suppose my quick answer is build your team, and if you can enable them to help you deliver the role, you can sort of free yourself up to do some of that activity, and likewise enable them to do it so they can give themselves some breathing space for development. That would be my my main tip,
And I
suppose.
guess, yeah, no, that's really pivotal, isn't it? Because that also enables them to grow into the next
Completely.
steps as well. And you have that internal kind of career pathway for them, which only, encourages and motivates people, doesn't it? So no, I think that's brilliant. Shilpa and Charles, because you obviously take a lot of clinical development as well. How do you manage your time?
I was going to say what,
first.
I was going to say what and now I can't remember what Sam said earlier about making it a priority, and that's really difficult to it's taken me many years to kind of go, right, this I need to keep growing, and right now I'm probably in my biggest growth period because my kids are quite a bit older now. They're moving out. One's moved out and one's about to move out, so I've suddenly decided to kind of focus on myself more. But having said that, I had about 15 years in community pharmacy, and I used to think, I didn't really grow whilst I was there, but you build resilience, you pick up all these business skills, you pick up management skills, leadership skills, and I think all of that has now suddenly come together. And in the last 10 years, it's really helped me with what I'm doing right now. When I get pharmacists applying to work at our practice, I always say, go out and try lots of different things before you come here. Like if you've been in community pharmacy for 4 or 5 years, you learn so much before you're able to, come and work in GP practice. So it's not like you have to jump straight into that final role that you want to be in. But also, as Sam says, I spend a lot of time trying to get the rest of the pharmacists in our teams to be working at their best, just try and get as much as possible out of them. And at one point I used to think, oh, I can't make them do all this, but like you say, Preeti, it's helping them grow. So I try as much as I can to get them to do a lot so that I've got more time to do other things, and they seem to feel really fulfilled from that, and they feel like they're being trusted to do everything without me. And then I suppose the final thing there is that I'm very flexible. So although I might not have I don't even have set clinics anymore, but I jump into when someone's on holiday or when someone's off sick, I kind of jump in and out. So my role is very flexible now, which means I can stay on top of all the skills because I have to know how to run every single clinic. But I also, when we've got a full team, I can take time out to do other things. But like even today's podcast, I was, it did occur to me that maybe I should just cancel because I'm so busy. But you have to prioritize these kind of things, if and so that's quite difficult to do. But you just have to.
Yeah, no, absolutely. And it is that priority, isn't it? And it's also going back to why you're doing this as well. So it's almost with each and everything is, why am I doing? What am I doing? And actually, when it becomes a priority, it's where you want to achieve it. So right at the beginning, you said it's about inspiring. You want to be able to inspire people. And it's only through vehicles like this that you're able to do that. So I guess that goes on the top of the priority list, doesn't it? So Charles?
Yeah, I think I agree with what everyone has said. I think the only slant to everything that's said is when it comes to, at least my personal experience, when it comes to progressing in pharmacy or progressing in a career, it's the two things that are always into play, which is time and opportunity. And very depending on your background, you could bring in the equality and diversity inclusion situation into pharmacy. Not everyone gets the same opportunity. People have had employers that don't give them the opportunity to get in the leadership roles. Some people don't actually have leadership roles. They're more of the ones that serve rather than lead. So when it comes to time, they don't actually have the time. The time is very created for them by their bosses. So it's very, very difficult for those people to squeeze time to do self-development. And that's often the challenges I know from those from the Black ethnic minority backgrounds that our pharmacists have struggled with, because there's no time, because they're not privileged in that sense based on the issue we have in terms of equity and diversity. So opportunity is not always available. And that's why I think, like most of the colleagues have said, is trying, whenever an opportunity shows up, is trying to maximize it the best you can. And what I always tell people is don't wait for an opportunity to show up. Be prepared before the opportunity comes around. There's a saying we used to have when we were kids: if you fail to prepare, you prepare to fail. So it's always trying to prepare before the opportunity comes, because unlike other colleagues that don't look like you wouldn't get the same chance at that opportunity. So you need to be extra prepared when it comes, whereas other people might have second chances at it. So bearing that in mind, I've always put myself in a situation where taking opportunity has always been a priority. Trying to get training, I've always had to self-fund. So people were getting funding, but I wasn't going to be one of those people that get funded. Do you know what I mean? So
Yeah.
you have to take that risk of getting the funding. And I think that's why I said in the beginning that it's good to have an idea where you want to go to. It doesn't have to be a fixed idea. There has to be flexibility. But you have to have an idea, because even though you're going to spend time roaming around, because you might not get the same opportunity like other people get to try things. And when you get stuck, then you're stuck for life. So it's trying to make sure you have a bit of an idea in your mind. Reading books, Steve Covey's book was amazing, 7 Disciplines, very important. And trying to get opportunities where you could just slide things into your day, your weekends, trying to make those sacrifices. And that's why I said early. Try to do it early in your career, because like Shipa's kids are living, that's great. Some people are just starting your family now. It becomes a pressure in itself to start squeezing things in there. So it's trying to, and then as Samantha said, it's trying to see if you can get a good employer. If you have a good employer, a good line manager, then you might get a better chance. But a lot of people struggle to have that, especially within the NHS. So it's making sure that you sort of take responsibility for your own development. And taking responsibility means making time for the things that matter and accepting the fact that you might not have the chance to try everything, but make sure you're flexible enough to try enough things that you are interested in, so at least you can make an informed choice. So yeah.
Yeah, and I think leading on from that, isn't it? It's about having some open and honest conversations with your line as well. Where do you want to get to? What do you see the next chance? There may not be that leadership opportunity, but actually, where do you see yourself in that 1 year or 6 months, and where do you want to be? And having those brave conversations to help, navigate your way through your career path. Because if it's not maybe an upward step, there may be a sideward step. And I think that's something that, we do our GCSEs, we do our A levels. It's all, we then go to uni, we get our degree. It's all very in that, upward trajectory. But actually, when it gets to our career, that's sometimes not the case. And I think that's certainly something, I often speak to pre-registration pharmacists, and they're like, well, how do I get to your role tomorrow? I'm like, no, guys, you have to go through different opportunities, because actually that's the toolkit you're building for life. It doesn't matter if a role, may not give you the next superintendent role, as we used to say, didn't we, when we were back in community? But actually, you're building a toolkit. Every single job is enabling you to build a toolkit for your future career pathway.
Preeti, if I can give an example based on what you said, which is quite interesting, because the sidestep is very important. I've had to sidestep twice in my career, and they were the best decisions I ever made. Not because my employers were horrible, but because sometimes people miss a trick. Especially for those listening that are probably from backgrounds like mine. We're often very loyal workers. We're loyal, and we put a lot of emphasis on our line managers and our bosses to help us develop our career or show us the way. But the reality is that, just like parents, sometimes your line manager, your bosses have an idea for you that's probably not the idea you want for yourself. And you need to be comfortable to have that conversation to sidestep. So there was a time I applied to do a program, and it was going to be fully funded and everything. And I remember sitting with my line manager at the time, and she looked at me and she said, actually, we have other plans for you, even though we have this funding, and even though we can fund this, and even though the money is there, and blah, 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 but we think that you should be here. And I thought I had to be somewhere else, so I had to sidestep.
Yeah.
And I sidestep was the next best thing. Then when I started my diabetes career, I got picked by the consultant, was being trained by the consultant, and then they were going to apply for a study leave. I was going to self-fund and everything else. There wasn't a problem with it. Everybody was happy with it, but the boss was, I don't think we're ready for that now. Maybe wait another year. But that's your life. And that's a decision you need to make for yourself. So I had to go unemployed, and I had to sidestep. But all those sidestep got me to where I am today, which is a lot farther away than where I was supposed to be. But does that mean my bosses were cruel? No, they had their own plan, because they have their workforce they have to manage, they have whatever they have to do. So you have to have a clarity for yourself what you want. Because if you're always waiting on a boss to empower you, to inspire you, that might not happen. Especially if you're from an ethnic minority background, it might not happen. So you need to make sure that you take a bit of ownership of your career and be confident enough to sidestep. So that's why I thought I'd bring that example.
One step back and 2 steps forward, isn't it?
That's absolutely. So that brings me to the end of this podcast, and I'd like to thank you all. You've had some you've shared some real nuggets of advice for our pharmacists, so whichever role or sector they're in, and really great to get a little bit of a more in-depth view of your career pathways, which I think we can absolutely all learn from. So, if you are listening to this thinking, well, what development do I need? Well, we do a range of courses, whether that be leadership or clinical development, and that's available on our website on www.educationforhealth.org. And there's also quite a vast range of free resources there to support you, including our latest leadership podcasts that are available on our website and indeed now on Spotify. So that brings me to the end of today. Thank you so much to all of our participants today, and I look forward to our next career pathway conversation. Thank you.
Thanks, Preeti.